Sex during pregnancy and postpartum is often a taboo subject that is rarely talked about. Yet many couples have numerous questions and concerns about their sex life once they know they are pregnant. Sex is a normal part of a healthy relationship and a healthy pregnancy. So let's address some of your questions and concerns. The general rule is having sex during pregnancy is safe unless your provider has told you otherwise. Sex will not harm your baby because the penis or sex toy cannot enter the uterus and instead stays within the vagina. The uterus is where the baby is growing and developing, and the uterus is closed off from entry by the cervix. Many couples worry that their baby can tell what is happening during sex. Babies remain unaware of sexual activity and may actually enjoy the motion of movement and the orgasm a mother experiences. Once you find out you're pregnant, the biggest fear you and your partner will have is miscarriage. 10 to 15% of pregnancies will end in miscarriage, and half of these are due to genetic abnormalities. Many other miscarriages have an unknown cause. Miscarriages are not caused by sex, and sex is safe unless your provider has told you to abstain from it. If they have not done this and you want to have sex, have sex. Enjoy it and don't be afraid of it. Sex can be very enjoyable during pregnancy and sometimes even better than pre-pregnancy. However, it is often necessary to make some adjustments in order to have the experience be better for both partners. Sometimes sex can be uncomfortable or even painful. Reasons are often caused by hormonal changes and include vaginal dryness, breasts or nipples being sore, or the vagina feeling tight or small. Some women may also experience a feeling of pressure on the bladder that makes it feel like they need to pee. That being said, sex isn't always painful and can have many benefits. Some women have more lubrication due to hormones. These extra secretions help protect from bacterial infections in the vagina or uterus, which could harm the pregnancy and baby. Additionally, there is increased blood flow to the entire reproductive region, including the clitoris and the vagina. This can cause increased genital sensitivity, which in turn can provide greater pleasure and better orgasms. Women may also have increased sex drives due to hormones, and sex can help bring couples closer together. Orgasms release hormones that can have a calming effect and increase blood flow for both mom and baby. Sex releases endorphins, which improves mood and burns calories, and there is some evidence that it boosts a woman's immune system. Bottom line, if your sex life is enjoyable, keep going. If sex is painful, talk with your partner and your provider. And don't assume it's normal for pregnancy. Believe me, talking about sex is part of the job and your provider is used to it. Before we get into positions, it's extremely important to remember that sex is not only about penetration. Many couples can enjoy intimacy and enjoyment through foreplay and makeout sessions. Talk as a couple and see what you are both comfortable with. Not all women or men want to have penetrative sex during pregnancy. Positions you can try that are safe and can be quite stimulating and enjoyable include lying sideways together. This can be face to face or spooning. This position works because you're off your belly, but it is well supported and penetration can be less deep. Additional positions that you can try include woman on top or cowgirl, reverse cowgirl, woman propped upright, doggy style or sex from behind while the woman is on her hands and knees, standing, sitting on the edge of the bed, and missionary position until the 4th month. This should only be for a short time or a quickie, and your partner should not put their full weight on you. Positions to avoid include missionary after the 4th month. This is because compression of a woman's internal organs and blood vessels, which can change the blood flow to the baby and can also lead to feeling dizzy or lightheaded. Also, avoid being prone or on the belly because you should not put pressure on your pregnant belly. Oral sex is safe and it can be enjoyed throughout pregnancy. However, it is very important for partners to know that you cannot blow air into a pregnant woman's vagina. Rarely, this will cause a serious complication called an air embolism. An air embolism is when an air bubble blocks a blood vessel. This can be life-threatening to you and your baby. You are able to give and receive oral sex, and unless directed by your healthcare provider, swallowing semen is allowed. Anal sex is also permissible during pregnancy, but must be done safely. First, hemorrhoids are a common condition experienced by pregnant women. Anal sex can irritate hemorrhoids, causing pain as well as bleeding. It can also lead to anal fissures if the tissue is dry and under-lubricated. Additionally, the anus is full of bacteria that, if introduced into the vagina, could cause harmful infections for mom and baby, including bacterial vaginosis and urinary tract infections. Due to this fact, your partner must not penetrate the vagina with fingers, sex toys, or a penis after it has been in the rectum without thoroughly washing it first. If using restraints, cuffs, or ties is your preference, be sure that nothing constricts your pregnant belly or leaves you on your back for long periods of time. Experimentation and exploration are key to sex during pregnancy. It's okay and encouraged to think outside the box. Items that can assist you in better sex include pillows for support, sex toys, and lots of lube. Everything is about trial and error. Not only new positions, but new activities like sex in the shower. If you're not feeling sexy, try looking at pictures of naked pregnant women, or book yourself a sexy boudoir picture shoot. Buy new racy maternity lingerie. Plan romantic dates with your partner. And partners, tell her all the time how beautiful and sexy she is. The first trimester can be full of obstacles when it comes to having sex. Women often experience morning sickness or a nauseous feeling. Sore nipples and breasts usually begin to surface, and with hormones running wild, anxiety about having sex is a very real thing. Spotting or light bleeding after sex can be very common in the first trimester. It can be a sign of implantation of your fertilized egg or tiny blood vessels bursting during sex due to dryness caused by hormones. 15 to 25% of women will experience bleeding during the first trimester. If bleeding is caused by sex, it should be light or spotting. It will be light red, pink, or brown in color and should go away in a day or two. You should call your provider if this is the first time you have seen blood or spotting, if it lasts longer than 1 to 2 days, if it becomes dark red, if your flow is heavy where you're using many pads and must change the pads frequently, if you are bleeding and have cramping, pain, or contractions, if the bleeding is accompanied by a fever, or if the bleeding is inconsistent. If you have any concerns about sex or bleeding during the first trimester, don't hesitate to call your provider. The second trimester is usually a wonderful time for many couples. Women often have more energy and feel better than they did during the first trimester. Additionally, their bodies are curvier and sexier, but they're not yet overwhelmed by a giant pregnant belly. Thus, it isn't surprising that women report an increased interest and desire to have sex. The second trimester is a common time for cramping or Braxton Hicks contractions to begin after sexual activity. These can last up to 30 minutes after the end of sexual contact. After sex, getting into a comfortable position and breathing slowly can help calm your body down and may stop the contractions. Have your partner rub your back or feet, maybe put on some relaxing music if this helps. This is all very normal. However, always consult your provider with any questions or concerns you may have. Sex during the third trimester usually slows down. Men often report less interest and women report more fatigue. Additionally, both partners will often report difficulty finding positions that are comfortable and conducive to truly enjoyable sex. It is also common that more healthcare providers will recommend abstinence from sex for a variety of reasons. If sex is not an option, remember to cuddle, hug, and kiss, as this can keep you closer as a couple. The most important thing is to be patient with each other. The end of the third trimester often finds couples having sex to induce labor. If sex is still permissible by your provider, it can't hurt, but it probably won't do anything. Semen does contain prostaglandins, and prostaglandins can help ripen and soften the cervix. Nipple stimulation causes the release of oxytocin, which can stimulate the uterus and cause Braxton Hicks or labor contractions. And sex with or without an orgasm can cause uterine activity, which can also cause contractions. However, studies have not been able to prove sexual activity helps induce labor. If you are already at the end of your pregnancy, sex may help you go into labor, or labor may start despite your sexual activity. So continual sexual activity for pleasure and closeness, but not labor induction. Couples having sex in the third trimester may also have to deal with leaking colostrum from the breasts. Sexual stimulation releases oxytocin, which is also known as the milk ejection reflex hormone. Keep a towel handy or possibly wear a sexy bra or tank top to help with this. Usually after you have delivered, your doctor will tell you to practice pelvic rest for 6 weeks. This is for both vaginal and cesarean births. Pelvic rest means nothing is inserted into the vagina. This includes not just a penis, but also sex toys, fingers, tampons, birth control, douches, and menstrual cups. This also includes vaginal exams unless deemed as urgent or an emergency procedure. You must abstain from sex until the 6 weeks have passed. In addition, ask your provider if pelvic rest includes refraining from having an orgasm. Most doctors want you to abstain from sexual activities that could cause orgasm in order to give the vagina and the uterus time to heal. Luckily, most women aren't interested in sex because they're focused on healing from birth and taking care of their new baby. Additionally, partners are focused on their new role as well as taking care of mom and baby. Once the green light has been given, take time to re-engage in sexual activity. It may require a lot of creativity and communication to get you back to where you were before the baby arrived. Some couples report that it can take a full year. This is normal and healthy and will pass in time. Remember, all the tips we gave you to help you have enjoyable sex during pregnancy can help you now. Finally, if you are breastfeeding, you may want to wear that sexy bra or tank top while having sex. Support of your full breasts during sexual activity may be more comfortable. And when a woman experiences sexual stimulation or orgasm, her body gets flooded with oxytocin. More than one partner has told the story of when they got sprayed in the face with milk. Have a conversation to determine what is more comfortable for both of you as a couple. Most women and couples will not have to worry about having a healthy sex life during pregnancy. However, some situations will cause your provider to advise you to avoid having sex. These reasons can include heavy bleeding during pregnancy, vaginal or uterine hematoma, premature rupture of membranes or waters being broken, which increases the risk of infection, history of preterm labor, especially in the third trimester, history of multiple miscarriages deeming the pregnancy high risk, low-lying placenta or placenta previa. Placenta previa is where the placenta grows over the cervix. Low-lying placenta is at or near the cervical opening. These conditions could cause you to bleed during pregnancy, and sex could make the bleeding worse. Other reasons include problems with your cervix or incompetent cervix. This means your cervix is opened up too early in your pregnancy. If this happens, you could have a miscarriage or a premature delivery of your baby. If you are pregnant with multiples, and this is because your provider is trying to get you as close to full term as possible, they may prescribe pelvic rest in addition to bed rest. These are two different types of resting. Also, if you have signs of preterm labor, including contractions, backache, vaginal discharge, bleeding, or leaking from the vagina. And finally, if you have or are at risk for sexually transmitted diseases. Sexually transmitted diseases can trigger preterm labor. Your healthcare provider may recommend you abstain from sex if you or your partner have contracted an STD. Additionally, if you normally have multiple partners, your provider may determine that sex is inadvisable during your pregnancy. Make sure to protect yourself if you are at high risk of contracting an STD by using condoms or dental dams. And check out our series on pregnancy and STDs for more information. We will link that in the description below. Please remember, you may have a history of one of these conditions, but that does not necessarily mean you have to abstain from sex. You need to stop having sex when your healthcare provider has advised you to do so. Your provider knows your health and pregnancy history, and therefore they can determine whether sex is safe or not. Sex during pregnancy can be a wonderful and fulfilling experience. However, it's important that it is done safely and for the mutual pleasure of both partners. We hope this video has helped you determine the right way to move forward with sex during your pregnancy or postpartum and given you some fun ideas to experiment with. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.